Hi guys. So in today's lecture we will discuss hypertension, that is increased blood pressure as per standard guidelines. Hypertension is a very common problem and this is more common in males as compared to females, particularly in age group less than 65 years of age. Maybe due to hormonal effects, maybe due to lifestyle, but some people blame their marriage for this, indirectly their wives. But I don't think this is correct reason. We will discuss diagnosis of hypertension as per various guidelines and then we will take up the treatment part. We will also discuss how to measure blood pressure correctly regarding the positioning of patient, regarding the cough size, and if your patient is lady, you will also need to request her not to speak for a while because it can affect the blood pressure readings. Okay, so let's start this lecture. Right. So let's start our lecture assuming that your normal blood pressure should be 120 by 80 millimeters of mercury. We have been studying this particular data right from our childhood. So as of now, let's assume that your normal blood pressure should be 120 by 80 millimeters of mercury. 120 should be your systolic blood pressure and 80 is your diastolic blood pressure. Now try to understand one basic thing here itself. Your blood pressure measured in office, that is in clinic, might be more than your blood pressure measured at home. Due to various reasons, you can understand that at home you might be very relaxed. Whereas in office, that is in clinic, you might be bit apprehensive, that you might be having bit of anxiety, resulting into increased blood pressure. As of ISH guidelines, that is International Society of Hypertension, apart from office BP monitoring at home has to be also done, and this particular thing is known as out of office BP monitoring, out of office blood pressure monitoring. Try to understand, at home you yourself can measure your blood pressure with help of digital sphygmomanometer. First you can measure blood pressure during morning and then you can measure your blood pressure during the evening. An average value has to be taken. You can only measure your blood pressure when you are awake. You cannot measure your blood pressure while you are sleeping. So in case of home blood pressure monitoring, patient will measure his own blood pressure while he is awake, of course, during morning and evening. Whereas in case of 24-hour ambulatory blood pressure monitoring, average value of day and night blood pressure is taken with help of 24-hour ambulatory blood pressure monitoring with help of a device. Try to understand, whenever you are awake, your blood pressure is slightly more compared to when you are sleeping. So in case of 24-hour ambulatory blood pressure monitoring, average blood pressure will be calculated by blood pressure during the day as well as including the blood pressure during night. During night, blood pressure is quite low. We will discuss over a period of time. Whereas during day, by saying day, I mean that your patient is awake. During night, I mean that your patient will be sleeping and BP will be far lower as compared to the awake values. Therefore, home blood pressure values will be greater as compared to the average value of 24-hour ambulatory blood pressure monitoring. Now, I hope it is quite easy to understand. During night, adrenergic drive is lower as compared to during day. Therefore, during night, blood pressure falls to a significant level. Now, try to understand. By this chart, I am trying to convey that all these blood pressure measurements are very, very important in classification as well as management of hypertension. Try to understand, office blood pressure is highest and then you have home blood pressure and then you have average value of 24-hour ambulatory blood pressure. Try to understand, suppose someone's blood pressure during office recording is 140 by 90 and same person's blood pressure when blood pressure is recorded at home comes out to be 135 by 85 millimeters of mercury. Same person's blood pressure during 24-hour ambulatory blood pressure monitoring comes out to be as average 130 by 80 millimeter of mercury. Now you can appreciate that office blood pressure is higher by 5 millimeter as compared to home blood pressure and home blood pressure is higher by 5 millimeter as compared to average value of 24-hour ambulatory blood pressure. So there is gradient of 5 millimeters of mercury. Try to understand, if someone's blood pressure in office is 140 by 90 or more, it will be labeled as stage 1 hypertension. If someone's blood pressure at home is 135 by 85 or more, it will be labeled as stage 1 hypertension. If someone's ambulatory blood pressure is more than 130 by 80 or 130 by 80, this will be labeled as stage 1 hypertension. So now you can synchronize the data. You can equate office blood pressure values with home blood pressure values with ambulatory blood pressure values. So you have three readings: office blood pressure measurement, you have home blood pressure monitoring, and you have ambulatory blood pressure monitoring as well. This particular thing is known as home blood pressure monitoring, and this particular thing is known as ambulatory blood pressure monitoring. So you have office blood pressure monitoring and out of office blood pressure monitoring in form of home blood pressure monitoring and in form of ambulatory blood pressure monitoring. So this basic understanding has to be developed so that you don't struggle with various guidelines and treatment protocols as per various guidelines. Right, this is your ambulatory blood pressure monitoring. I have already mentioned that average value of 24-hour ambulatory blood pressure will be considered as most accurate. That is ideal blood pressure. So this is your ideal blood pressure monitoring. That is ambulatory blood pressure monitoring. And American Heart Association has classified hypertension into normotensive, into elevated BP, into stage 1, stage 2 and hypertensive crisis. And American Heart Association guidelines correspond very well to the values of ambulatory blood pressure monitoring, right? Now let's discuss classification of hypertension as per American Heart Association guidelines. So now we will discuss American Heart Association guidelines for the classification of hypertension. And this is based on ideal blood pressure values. And ideal blood pressure values can only be obtained with help of 24-hour ambulatory blood pressure monitoring, which might not be practically possible when you treat any patient. So ideally, you have to use AHA guidelines for classification of hypertension. And as per AHA guidelines, normal blood pressure is not 120 by 80. Normal blood pressure should be less than 120 by 80 millimeters of mercury. This has to be noted. Earlier, we did discuss that normal blood pressure should be 120 by 80, and we have been studying this particular data. But normal blood pressure as per AHA guidelines should be lesser than 120 by 80. Now, right after normal BP, you don't have hypertension. You have one more stage that is known as elevated BP. And in this elevated BP, diastolic BP remains normal, but systolic BP increases slightly. That is in the range of 120 to 129. That is less than 130. Try to appreciate. This elevated BP category is not hypertension. We will have a stage 1 hypertension when systolic BP will be in the range of 130 to 139, and for the first time diastolic blood pressure is going to increase, and this is your stage 1. In case of stage 2, your blood pressure, that is systolic blood pressure, will be more than 140 and diastolic blood pressure will be more than 90. So these are stages of hypertension, and sometimes blood pressure can be even higher. Any blood pressure more than 180 by 120 will be considered as hypertensive crisis. We will discuss hypertensive emergencies in detail. So, as per classification by American Heart Association, you have normal BP less than 120 by 80, and then you have elevated BP. This elevated BP is very important because in this case, though your blood pressure is on higher side, you have to manage your patient with help of lifestyle modifications. Whereas in rest of the cases, antihypertensive drugs can be used. Let's again recap classification provided by American Heart Association. As per American Heart Association, let's again write normal BP should be less than 120 by 80 millimeters of mercury. What about elevated blood pressure? In case of elevated blood pressure, diastolic blood pressure should not increase. There should be only minimal rise in case of systolic blood pressure, and this rise should be in the range of 120 to 129. This is your systolic blood pressure in case of elevated BP. Diastolic blood pressure will stay constant, that is, it will be less than 80. In case of elevated BP, your treatment should be only lifestyle modification, no drug therapy should be given. But you need to follow this patient. Now, you will have a stage 1 hypertension. In case of stage 1 hypertension, for the very first time, diastolic blood pressure can increase. Here you have systolic blood pressure in the range of 130 to 139, and then you have diastolic blood pressure in the range of 80 to 89. In this case, in case of a stage 1 hypertension, patient can be managed with lifestyle modification only if there are no risk factors, and a score by the name of ASCVD score comes out to be very low. We will discuss. Whereas in case of stage 2, You have to treat your patient with help of antihypertensive drugs, any systolic blood pressure more than 140 and any diastolic blood pressure more or equal to 90 will be considered as stage 2 hypertension. Last but not the least, you have hypertensive crisis. In hypertensive crisis, your blood pressure will be equal to or more than 180 by 120 millimeter of mercury. And if it is associated with target organ damage, we will discuss, it will be labeled as hypertensive emergency. Now, let's proceed. So, as per AHA guidelines, that is American Heart Association guidelines, in case of elevated blood pressure, only lifestyle modifications will be advised. Whereas in case of stage 1 hypertension, you can provide antihypertensive drugs depending on what are the other risk factors. Try to understand if there are no risk factors. If atherosclerosis, cardiovascular disease score comes out to be very low, then only lifestyle modifications are more than enough. But if there are risk factors, for example, patient have had attack of MI, a stroke, or his atherosclerosis cardiovascular score is very high, then in this case you have to provide antihypertensive drugs. See, you cannot provide any unnecessary drug to any person. In this case, antihypertensive drugs should be used along with lifestyle modification. Whereas in case of stage 1 hypertension with no risk factors and with atherosclerosis cardiovascular disease coming out to be low, only lifestyle modifications has to be needed. Whereas in case of stage 2 hypertension, you have to give this patient antihypertensive drugs along with lifestyle modifications, no matter whether these factors are present or not. So, this is basic crux and basic use of American Heart Association guidelines for hypertension. Now, let's proceed. Now, let's discuss two very important terminologies, that is white coat hypertension and masked hypertension, exactly opposite to each other. In case of white coat hypertension, office blood pressures are higher, whereas home blood pressures might be normal. So, this is known as white coat hypertension. It might be due to terror of white coat. So, in case of white coat hypertension, home BP might be normal, but office BP might be high. And in this case, office BP can be more than 130 by 80. This qualifies as a case of stage 1 hypertension. But in case of white coat hypertension, you will persistently get normal blood pressure recordings at home. In this case, you don't have to start the antihypertensive drugs. In this case, only lifestyle modifications are more than enough, and then you have to subsequently follow this patient. Whereas in case of masked hypertension, anyone masked is very, very dangerous. So, in case of masked hypertension, home blood pressure will come out to be higher, whereas office blood pressure, that is clinic blood pressure, might come out to be normal. This is dangerous condition. In this case, you have to provide antihypertensive drugs along with lifestyle modification. Okay, so this is major difference between white coat hypertension and masked hypertension. In one case, office blood pressure has increased, but home blood pressure is normal. In the other case, reverse has happened. But this white coat hypertension is not that dangerous. See, this can be a transition state. A person might be normotensive, a person might be having white coat hypertension, and over a period of time, he can develop hypertension.